Welcome, everyone. Thank you all very much for attending this special Marion Area Chamber webinar presentation. First, I'd like to quickly shout out to Leslie Schneider from United Way of Marion County that brought this idea to our attention. I'm sure you folks, like us, have certainly had no shortage of webinar invitations, many coming from state and federal level related to different aspects of the pandemic. But we figured since most of the guidance was then pointed right back down to representatives at the regional level or county level, why not have some of our local experts weigh in, starting with a summary of kind of where Marion County currently sits with COVID-19 cases, what the guidelines will be for all businesses, what the staggered reopening timeline looks like, what are some tips we can learn from essential businesses that have been open to use in our own locations, what things we should think about when we're deciding when to reopen, even after the closures are lifted, paycheck protection plan and other SBA programs, employment, frequently asked questions, and more. So with that said, I'd like to quickly introduce our panel today. Very happy to be joined by two representatives from our local public health department, Health Commissioner Traci Kinsler and Director of Environmental Health, Tyler Pigman, from Small Business Development Center, Business Advisor Michalina Lacy, and from Marion County Job and Family Services, Director Roxane Somerlot. So this will be somewhat of a free-flowing presentation with each group starting with an overview of the situation from their organization's perspective. And they'll talk a little bit about what sort of questions they've encountered that hopefully many of you in the audience may also have had questions on. And if I set this up correctly, I believe during the presentation, you should be able to click or tap a chat button and type in questions you have, and we'll try to leave time at the end to answer those. Also, for your information, this webinar will be recorded, hopefully, and shared in one of our upcoming COVID-19 summary emails. Hopefully those have been helpful. And if your specific question doesn't get answered or you'd like to talk to these folks directly, their contact information will be added with the webinar recording. And just before we get started, I want to give another quick shout out to our local Marion County Emergency Management Agency, Director Sarah McNamee, who is also in this meeting today to help flesh out any questions. And a reminder, if anyone is looking to either donate or procure personal protective equipment, Sarah is your Marion County hub of that information. Her contact information will also be included in our follow-up. Now, with all that out of the way, I'd like to have the Marion Public Health kick us off, Traci and Tyler.
Thank you, Matt. Can you hear me?
I can, yes.
Okay, perfect. All right, well, I wanted to say thank you to the Chamber and to Leslie from the United Way for getting this organized. I think this is a great idea. And thank you to everybody who's participating today. Hopefully we can get some good stuff out of this and help us all kind of move forward together. So I just wanted to start with kind of an introduction of the public health sort of lens to this. I know that this, it's kind of a strange relationship we're all about to have. A lot of you have never been regulated by us, and we've never been, trained on how to, have that relationship with you to do inspections and things like that. So it's brand new territory for all of us, and we're just kind of trying to find our way through it. So we appreciate your patience with us as we learn how to do this just as much as you're learning how to do this. I kind of wanted to start with an overview of where we are in our outbreak. So as of yesterday, we had 2,196 cases. 125 of those are community spread, and the other 2,071 are inmates. And so I know there's been a lot. You've all heard the news. We've kind of been getting worldwide attention for our outbreak. And a lot of people just attribute that right to the prison and the inmates, and they say that, it's not a community issue. But it really is, because even when you take out the inmate population, our per capita rate of community cases is in the top for the nation. So we are seeing a higher than average outbreak here in Marion. And while it can mostly be attributed to the correctional facility, a lot of it can't. About half of it is just genuine community spread. So it puts us in a different situation here in Marion because we are in the middle of such a big outbreak, and everything continues to be so delicate. And so our role in public health is prevention. It always has been. So for this pandemic, it's no different. We're trying to prevent people from getting really sick and prevent death. And so that's a lot of the rules and regulations that you're seeing coming from the Ohio Department of Health is to prevent that. It's kind of a double-edged sword because then you have people saying we don't have a problem, but we don't have a problem when we are preventing the problem from happening. So it kind of can get a little bit sticky that way. But I wanted to kind of talk about the next month or even year as we move forward. And although we don't have a crystal ball into the future of what's going to happen, we know from previous pandemics, from other countries, even from other states, you know, what we're kind of in for as we reopen. And so inside the health department here, as crazy as it has been, as busy and overwhelming as it has been so far, we are viewing the last month and a half or 2 months as a warm-up to what's to come. As we open up, we expect to get a significant more amount of cases and to be more overwhelmed than we are right now. And so that's why you see the state trying to figure out how to help us with contact tracing and things like that. So far, when we have a case, it's easy to figure out who they've exposed because most people are at home. Now that we start to open up, their amount of people that they've possibly exposed is going to be much bigger. And that's going to take a lot more time, and the spread will just kind of touch off more regularly. So as we talk about these, you know, rules and regulations that the state has put out there, you know, that's the place we're coming from. How do we continue to not get our systems overwhelmed? How do we continue to protect vulnerable populations, which we have a lot of in Marion? If you kind of can even remember life before the pandemic, we were talking about the social determinants of health, how we have these issues with poverty, with lack of primary care physicians, with lack of dental care, and we have higher than average asthma rates, cancer rates, heart disease. So these kinds of issues like the pandemic can and will continue to affect us differently than it might affect our surrounding counties. So kind of with that, you know, that's why we're taking this maybe more seriously than you feel like another county close to us might be. And that's where we're coming from. We really want to try to prevent as much as we can while having that balance between people being able to live life, because we understand what's life. You know, if you don't have a good quality of life, it doesn't really matter if, you know, for living. So there's that balance that we're always trying to kind of figure out. So with that, I'm going to turn it over to Tyler, and he's going to talk about more specifics about what these new rules are that we've been given.
All right, thanks, Traci. Can everybody hear me?
Yes.
Awesome. It's like my first official Zoom. It's a new world we're living in. First, I just want to thank the Chamber and Matt, definitely. I'm going to go over a couple things today. You know, the mandatory protocols, you know, to keep your employees and your customers safe. I'm getting a call as I'm doing that. And I want to share some best practices that we've seen in the field or places that have called the health department and said, hey, Tyler, what do you think about this? What do you think about this? And some really good tips we've picked up. Before I get into mandatory protocols, I want to highly advise everybody, you know, the businesses that are opening May 4th and May 12th, there's specific industry requirements. The Chamber has sent this out, I believe, multiple times in their emails. It's the Responsible Restart Ohio. I think Matt, I don't know if you can share a slide of that or whatnot, but it's industry specific. Oh, thanks. There's even maybe one of the other PDFs too, Matt. There's specific protocols for consumer retail services, general office environments, and manufacturing. Perfect. That's exactly what I was looking at, that last one. There are specific protocols depending on each industry you are in. You know, and this doesn't cover everybody. This is the first three main ones where they're trying to reopen Ohio. Now, within all these within these different documents for all the businesses, there are 6 mandatory protocols I want to go over that everybody in every industry is going to have to follow. The first is the requirement of face coverings. for all your employees, and then recommending them to clients and customers. Maybe posting a sign on your front door for customers, since at this point, for clients and customers, it is not mandatory. And towards the end of my presentation, I'll go over what the Lieutenant Governor discussed yesterday with the exclusions to that. But that's the first one, requiring face coverings. The second part, the second mandatory protocol, is conducting daily health assessments by the employers and employees to determine if they are fit for duty. Generally, what this means is if they're sick, if they're exhibiting the symptoms, they shouldn't be coming into work. They shouldn't be working with their coworkers. They shouldn't be, dealing with your clients and customers. The third protocol is maintaining good hygiene at all times. Hand washing, sanitizing surfaces. We'll get into that in a little bit here too. The fourth is the clean and sanitizing workplaces throughout the workday. The main focus of this is high contact areas. What are people touching? What are multiple people touching? Do you have, I know at the health department, we have a community big printer. How often is that being sanitized? Keyboards, any type of workspaces where multiple people are at, you definitely want to clean and sanitize those many times a day. The next mandatory protocol is limiting capacity, establishing your max capacity of your building or workplace at 50% of the fire code. That is mandatory. That is in these new requirements. And I got a couple questions yesterday about that. They said, Tyler, we did our occupancy permit, decades ago. How would I know this? Contact your local fire authority. I know in the city, it's Mike Mikowski. He should be able to help you out with that, if you don't know your capacity. I talked to him this morning, and he's more than happy to help out. And then the last protocol, it's mandatory, ensure 6-foot distance between employees and employee customers. We've been hearing about this since March, since the start, but now it's mandatory for all businesses. And, if you can't maintain that, install a barrier. So a question I've been getting is, Tyler, what barriers, what can I do? Any barrier's fine. We see a lot of people using plexiglass. It could be anything like like a plastic curtain, any barrier to prevent the spread of any pathogen. And I recommend using these protocols. Develop a plan within your own agency, within your own workplace. Every business is different. I can't sit here and, go over all of Whirlpool's guidelines, because that's not going to fit, a restaurant, and a restaurant's not going to fit an insurance place, and that's not going to fit a bank. So using these guidelines and going back to what we initially discussed, the Responsible Restart Ohio sheets, use those to develop your own plan. And the next part I want to talk about is what happens when you have an employee that does test positive for COVID. Immediately report that employee to the local health department. Tell us, at this point, we can help. We can help with who needs quarantined. This is where we will start our contact tracing. We can work with you to develop appropriate communication, to your staff. Then the next part of that is, and part of these mandatory requirements, shut down the facility. Now, I'm not telling you how long to shut it down, what it needs to be done for. We're saying shut it down because that place now needs a deep cleaning and sanitizing. What they're calling now is a deep sanitization. And normally what we'd recommend, and what they're recommending in these documents, hiring a professional cleaning company. I believe I was looking at the chamber directory, and I believe the chamber has members that are professional cleaners. Is that right, Matt? I believe so. And if not, maybe you're a small business. Maybe you feel don't need that. Come up with a cleaning and disinfection plan. I don't know if we're going to send out documents after this, but just yesterday I received a document with the EPA and CDC. They just came out with cleaning recommendations for businesses, how to restart, or if you have somebody that tests positive, use that. That's your basis. And frankly, if you do have a positive case, I am aware of one we had recently. I'm in contact with you. I'll be calling, I'll be following up with the manager. I've talked to district managers, general managers as well. What precautions are you taking? We are going to follow up to make sure you are sanitizing, you are cleaning that before people come back and work or clients come back in the facility. So that's the mandatory requirements. And I know we're probably going to take questions at the end. So I'm going to go into, Matt asked me, what are some tips? Well, what are things we're seeing out in the field? What are people doing? I want to share that. I've heard some really good practices lately and stuff we've seen. The mandatory requirement right now is, 50% occupancy. No one's saying, you can't go less than that. That can inspire consumer confidence, so going below the 50%. Limiting or roping off access to areas or rooms in your facility. That can also mean less cleaning, less disinfection if no one's going in those rooms. Something else to help you all out. Don't make your lobbies inviting. Take out chairs. Turn off TVs if you have those out there. Definitely limit the number of people. Obviously, we don't want people congregating. So making an environment where they come in, do their business, and leave, that's best. That's what we want. If it's an area with, where people check out, maximize those checkout areas. Mark the floors. I know we're seeing that at a lot of grocery stores, marking the floors every 6 feet. Now, and the stores are doing pretty good. Now, myself and my employees, our next step is making sure they're policing that well enough, making sure they're keeping that distance. But just marking that is very important. Some other things you can do, suspending return policies. That's keeping less people out, maybe pushing them down the line where they can come in later and return a good. Appointment-only services. I've heard of a lot of places doing this, banks, different type of facilities like that, where if you have to do something in person, make it by appointment only. Something, we've seen throughout this whole process and we highly recommend continue, increase the availability of curbside service. The less direct contact is best. And then my last thing I've seen out there is contactless payments where possible. Maybe someone can take a credit card over the phone. That's always best. That can really help out any financial transaction. So those are some tips I have. And one of the last topics I also want to discuss is what happens when there's a complaint. First, I'm going to let you know, going through this for 2 months now, if you are not following those mandatory protocols, an employer or customer is going to call me. That's what's been happening. So, make sure the mandatory stuff I discussed that's on that sheet in front of you, in those industry-specific documents Matt also shared, read over those, make sure you're doing the mandatory stuff. There's recommended best practices, but if you're not doing a recommended best practice, and that's what we get a complaint on, myself or another employee of the health department is not going to be coming in. So let's say, there is something we get a complaint on, maybe something you're not doing. We follow up with everybody, whether by phone call or by a direct visit, depending on the severity, we do follow up. And something we want to see is intent. Are you taking the intent? Are you being intentional? Are you being deliberate to fix this problem? Just saying, it's a mandatory thing I don't care about. That's not acceptable to us. And also, we want to see if you have plans, put them in writing. Kind of what I discussed, a lot of these things are kind of catch-alls in these documents. Make something specific to your office. That will ensure employee confidence. Hey, these guys are taking it seriously. They care. They know what they're doing. So that's our process. Then lastly, what I was asked to speak on is the mask issue. It's a really big issue. We're getting a lot of calls about it. But the last thing we heard is, oops, I think I clicked on something wrong here. Sorry about that. Okay, I'm sorry, I'm working with a bunch of different documents. So the last thing the governor did explain yesterday was it is mandatory for employers for their employees to wear masks. Now, there are 7 exceptions I'm going to go over where you would not need a mask. The first exception is when an employee in a particular position is prohibited by law or regulation from wearing a face covering while on the job. The second exemption, wearing a face covering on the job is against documented industry best practices. The third is wearing a face covering that is not advisable for health purposes. The fourth is if wearing a face covering is in violation of a company's safety policies. Also, if an employee is sitting alone in an enclosed workspace, they would not need a mask. And then lastly, if there is a practical reason a face covering cannot be worn by an employee. Those are the 7 exemptions. And if you feel or a business feels they meet an exemption, put it in writing. You don't have to submit it to me, but if we get a call or a complaint, I'll either be there or I'll be calling myself. All right, where's your justification? I want to see that in writing that justifies one of these exemptions. So that's it with mask. And I will kind of end here. If you guys do have any questions, call me, call the health department. We can try to help walk you through it. A lot of this is based with businesses. This is very business focused. So you guys are technically the ones that are, going to be regulating, policing yourselves to make sure everybody's safe. Thanks.
Thank you so much, Tyler. I did see some questions pop up, but in the essence of making sure that all of our panelists get a chance to kind of speak before we are done here, I'd like to hold those questions until at the end, and then we'll come back to those and hopefully be able to cover those. So I will then hand it over to Michalina Lacy for the next section.
Hi.
Hello.
The Small Business Development Center, in case you weren't aware, and you could switch to the next slide, Matt, is a free business consulting service that helps individuals on a one-on-one basis at no cost to the individual. So if you are looking for ideas or solutions, basically things are going to change. It's not business as usual, and that means getting creative with how you're going to continue operating and sustaining your business. And you could switch slides. These are some of the areas of assistance that the SBDC typically works with. I know we're going to be doing some webinars on special topics related to issues with COVID and how to deal with those. So you can follow our Facebook page, and that'll be at the end. Information on that, on some of these free webinars. You could switch the, okay, so the first thing I wanted to talk about was some of the SBA programs that are out there resource-wise for individuals. There is the Economic Injury Disaster Loan, or the EIDL loan. This was something that I don't know if maybe you had, as a applicant, had applied one of the numerous times that the EIDL program was set up. That was kind of frustrating, admittedly, that you may have had to actually apply almost 3 times before you finally got the streamline application process in. If you were one of the lucky ones to get into the streamline application, you may have noticed you still have not received a phone call from SBA, and that is not unusual as they're trying to work through all those applications. They have not opened up the portal again with the second stimulus package. They had said they were going to, because now they're including agribusinesses and a few other sectors into that. And I haven't heard if or when they're going to open that up, because I think at this point they're trying to use those new stimulus funds to reach out to the existing applicants that had not received their advance and had not received any loan information. So it is possible that you may just wake up one morning and find money in your account if you did apply for this. So don't be shocked if that's the case. And it's usually $1,000 for every employee, up to 10 employees, so up to $10,000. And that is money that you would not have to pay back, but there are stipulations if you decide to also take the next program, which you could switch slides, the Payroll Protection Program. That is basically an SBA 7A loan that you would obtain from your local lender. So this does not go through the SBA.gov website. This is actually something you would work with typically with your existing banking relationship is who we're suggesting you go with that. And a lot of people did not make the first round. It was hard to get all those documents in a timely manner before all the funds are basically gone. So with the second round opening up, I do strongly recommend, if you are interested in these funds, to talk to your local bank about getting your application in. These can be used to pay payroll expenses, and say you're a business of one person, you're a single operated business. These are funds that you can use to basically pay yourself as well, and that would be based on your net income from your 2019 taxes. And while you don't have to have those taxes completed, you would need to fill out that IRS Form 1040C if that's applicable to you. If you're a S Corp or something, you may have a different form. Or if you are an independent contractor, you may just do the IRS Form 1099 miscellaneouses. If you do have employees, you would also have your quarterly IRS Form 941s from 2019. And you can go to the next slide. So those wages for your payroll are included in this loan, this forgivable loan. And it's not only just the payroll you pay your employees, it's also any employer health insurance contributions, retirement contributions, state and local taxes assessed on the employee compensation. So basically all the payroll expenses you would have, that's also included in this. And it would be up to $100,000 that you can pay. So if your employees make more than that, then they would basically be cut off at the 100,000 mark. And of course they have to be US citizens. If you do work with just 1099 employees, unfortunately, they would not be applicable to you paying for them, but they could go get their own PPP loan if they decide to do that as well. And you could switch to the next. There are some considerations with this though. 75% of those funds you receive, in order for it to be forgivable, meaning in order for this to be a grant instead of an actual loan, you would have to make sure 75% of those funds go towards that payroll. And it would be based on average payroll from 2019. So there are special situations where maybe you call back your employees and maybe they decide they don't want to work right now for whatever reasons. Maybe they prefer to stay on unemployment. Maybe they prefer to not put themselves in because they're immunocompromised or whatever. So you may have to actually give back some of those funds unless you just want to use it as a loan. So you'd have to keep careful records of those funds if you do receive this loan, because in order to get the loan forgiven, the bank's going to be asking for documents to make sure that those funds went towards what they were supposed to. The other 25% can go towards things like your mortgage interest payment if you own a building for your business, utility payments, some of those other expenses that you would want to talk to your bank with to be sure that they're spent in a way that you will not have to pay that loan back. If you do want to use it as a loan, you can do that. And then you're kind of more open to what you do with that money. And so that loan would be a 2-year rate with a 1% interest rate. And some people are actually taking their EIDL program loans and rolling it into the PPP loan, since it is a better interest rate than the 3.75 that the EIDL. So you can switch to the next one. And things that you're going to want to think about, even if you're at a point where we're able to open up everything, retail is going to be opening up here soon. Offices, service-related businesses, manufacturing, they're all slowly staggering their openings, but that doesn't necessarily mean, it's going to be business as usual. Unfortunately, you're going to have to take the measures that the health department, Tyler was talking about, to ensure not only your employees' safety, but to make your customers feel safe. And you really want to advertise those things too, because the customers will want to know what your stance is and what you're doing to make sure that, you know, you're creating a safe environment. And you also don't want to be liable if your employees get sick and your company is not taking all the precautions. So, you know, employees will be entitled to paid sick time. There are some exclusions to that, but so, you know, you'd have to pay at least 2 weeks of their sick time if they get sick with COVID, or if maybe one of their family members does. Employees can also potentially sue their employer. You know, we do live in a sue happy world. Employees can sue, customers or clients can sue. So you just want to make sure you're doing all that you can to reduce that liability. And a lot of what Tyler talked about is going to help with that. Employees discussing your employer's ill practices, you know, I think Tyler touched on this too, that if word gets out that you're not taking all the precautions you're supposed to be taking, that could lead to some bad reputation and bad press for your company. So you want to be mindful of that as well. Okay, next slide. Some of those responsible protocols, I won't totally go through all these because Tyler already touched on these, but definitely these are things that you should be considering. And, you know, one thing is, you know, if you are requiring gloves, making sure that they're wearing them properly. Same thing with masks. It's really hard to wear a mask and not touch your face all day and not, you know, basically you're just cross-contaminating things when you often do that. So having protocols in place for your employees on all of these things that apply to your business will be important. Consider staggering the arrival of your employees as well, if, you know, they're not all showing up at the same time for shifts. Okay. Retail considerations will go specifically into some of these. And again, I won't go through all the safety measure examples. You can kind of read through those. But the point being is you're probably, even if you're allowed to open up, there's still going to be client or customers and clients out there that do not want to come into your facility yet. Maybe they have health issues, or, you know, they just don't want to get sick. So continuing your curbside pickup and delivery options, giving them as many options for a contactless transaction is important. And, you know, you don't want to just have those in place. You want to advertise them so that your customers can feel good about doing business with you. You know, make statements like, we have taken XYZ steps to ensure you have a safe experience shopping with us. And you want to, if you do have retail options, you want to make sure that you're advertising those on either your website. If you have a website, this may be a good time to develop one if you've been on the fence. Advertise purchase options with, if you don't want to do a website just yet, maybe at least doing pictures on social media so that people can see what you have to offer. It's hard to buy stuff from you if you are not advertising what those things are and how they can safely purchase those items. Okay, next slide. Restaurant considerations. Again, you know, how can you do contactless processes? And also, how are you going to advertise that you do those? And consistently do those on a regular basis. I think curbside pickups and deliveries are also going to be a big piece of it. If you're a restaurant, though, and you serve alcohol, alcohol is obviously one of your biggest money makers when you were open prior to COVID. So now that we're allowed to do the 2 drinks with your dinner, that is something that may enable you to differentiate from other restaurants that maybe don't serve liquor, or also differentiate you from other restaurants that are serving liquor. You know, you want to consider the signature mixed drinks to go, something that's compelling or enticing for your customers to use your services. Consider different meal combos and deal combos. You know, a lot of restaurants are doing the family deals, which I think is going over quite well because you get a little bit of a price break as a family for eating out that way. And, you know, all of us are getting tired of cooking. So we're going to be enticed by what options you have. And with that, you want to post those options. Take pictures of your food and put them on your social media and websites, because that is how you're going to get people to say, That looks really good. We're gonna have that for dinner tonight. And this may be an obvious one, but I don't know how many times I've been to a Facebook page because maybe they don't have a website and I can't find a menu for that restaurant. So making sure that you can easily find a menu for that restaurant is going to be a huge thing as well. Okay. Next slide. Service business. A lot of this is going to be kind of reiterations of the other businesses. They will be opening up May 12th. But you want to prioritize safety measures with your employees and again, advertise the steps you're taking to ensure customer safety. We've already talked about masks and contactless transactions, practicing social distancing if you're going into homes, you know, being respectful of the homes by wearing foot guards maybe. I mean, that keeps their carpet clean, but also, you know, germs can be carried on the shoes. And, you know, sanitizing items, making that a priority with your employees if they're having to do repairs. Okay. Offices, they will be opening up May 4th. You know, and consider if it's still feasible for you to continue remote working. I know even some of the larger companies are already taking measures saying, you know, we could really reduce our overhead expenses by keeping employees working remotely. Production has not been a issue or a reduction with working from home. So if it works for the employees and it works for the business, you know, maybe continue working in that fashion. If not, you know, masks are mandatory if you're in an office with a lot of employees. You have to maintain that 6 feet distance between workstations, of course, and conducting daily health assessments, sanitizing, and like he had mentioned, the deep cleaning, sanitizing at least on a weekly basis, maybe. Okay. Manufacturing distribution, they'll be opening up on the 4th. Of course, you have the same issues, and I had talked about staggering shifts because you don't want everybody showing up and leaving at the same time. That's going to impact the social distancing. Pacing your operations, that's going to be an unfortunate drawback from all of this is production levels are going to reduce for manufacturers. They're not going to be necessarily able to operate at the same levels they were before. So, you know, how you're going to project and still be productive and profitable, that's something you're going to have to take into consideration. Sanitizing workstations and, you know, maybe putting in barriers. There are different places that are doing plexiglass. I know Cooper Enterprises and Shelby, they've kind of switched gears and they're doing some plexiglass installations for businesses. So if that's something that maybe you're interested in, there's definitely companies that are working for that. Okay. And if you have any other questions, feel free to give me a call. You can also follow the Facebook page there. Like I mentioned before, there's going to be some additional webinars that myself or other consultants will be putting on in the future months. And thank you.
Awesome. Thank you very much, Michalina. There were some questions that came up for you, and we'll try and cover those at the end as well. And then I will now hand it over to Roxane Somerlot, Director of Marion County Job and Family Services, for the next section. Hold on, Roxane. There you go.
Yeah, I'm going to rely on you to bring up those slides if you don't mind. Okay, thank you so much. Again, thank you to the Chamber, Matt, and all the people that have joined us today. Good opportunity to kind of find out what everyone's thinking and learn from the experience of all those that we're enduring this experience together. So for Marion County Job and Family Services, because we are Job and Family Services, our purpose relates to kind of two paths and two missions. We saw our first mission as with the health emergency as the mission to support families, but we also see as a responsibility that is very much intertwined as a mission to support our local economy. So just for informational purposes, all of our agency services, whether it be family support services or employer and job seeker services, are fully operating while our lobbies are closed to the public. So our agency isn't closed, but our lobbies are closed to the public. We have operated a call center for people to access the public assistance benefits, and that call center is in a hub with 8 other counties. We have moved all of those call center agents and fully equipped them to operate within their homes, and that has worked fantastically well, seamlessly and without any disruption for even a moment, I would say, to the public. Our Ohio Means job staff are performing all of their work duties from home. They're accessible by phone, by email, by fax, online. They're continuing to work with individuals and continuing to support businesses as they're contacted. And we've recommended that people visit our website just to be informed about the various programs we have to offer and how to access those programs and how to access us. So just wanted people to know that we're still here, we're still working, and we're still have a mission critical to support our community as a whole. So in supporting families in that space, we have seen a significant increase in the number of people that are applying for public benefits. And those would be in the space of health insurance, food assistance, and financial assistance. In order to allow us to focus on those new applicants, we've been helped by some federal waivers and some state waivers. So for instance, those families that were currently receiving assistance typically have to reapply or be recertified every 6 months, or in some cases a year. All of those periods have been waived so that we're not focusing on redetermining eligibility. We're able to focus on new applications for benefits, and that has been greatly appreciated. And actually we are, even though we've seen a spike of about 40%, we are all caught up and actually in a position that we've been able to help some other counties with their own backlogs. So that's worked really well. We had, for a period of time, probably a week and a half, we received some specialized funding from the State Department of Job and Family Services to operate a COVID-19 response program. We elected to follow the direction of most other counties in the state and set that up as a 500 grant that is paid to an individual, the person applying, so that $500 would be $500 per household. We were able to support 350 families with that one-time grant. The way that we designed that program, we particularly wanted to target those people and families that had experienced a loss of employment income because of the COVID containment efforts. So whether that meant a layoff, a furlough, or a reduction in hours. And we received over 400 applications within the first 4 days. And the thing that struck me about all of those applications is that they were from families that were not previously known to us. So they were new families applying and represented within our local community, people from the manufacturing sector, particularly with those manufacturing entities that support Honda, restaurants, bars, of course, some school employees, particularly, cooks, teachers' aides, those kinds of positions that were not under contract, childcare providers, and of course, personal service providers. If you worked in a hair salon or a barber, all of those entities and businesses that were impacted by containment efforts, we were able to support. So we found that particularly valuable because as we talked to those people applying and we interviewed by phone, all of them. They submitted an application directly online from the website, but we called all those people. Because they were new, we were able to take the opportunity to give them information about other services that we provide and other services that other community-based organizations provide as well. So we were pleased to do that. We continue to have a program that we operate that provides one-time assistance for financial circumstances that people may need just help with to get over the hump. That is in the form of payment for things like rent, mortgage, utilities, car repair, just any of those things that support a person's ability to look for work and to retain employment. And on the side of supporting our economy, we do house, and one of our divisions is the Ohio Means Job Center in Marion County. As I said, all of those staff continue to perform their work, and it's honestly been amazing to me. We have about 90% of our workforce working from home. How well that's gone and how productivity and really drive to provide service hasn't been diminished at all. So gave you some information about the contact person if you're an employer and looking for help with business related services. Annette Walton is your person. And then we have other staff that are devoted to individuals looking for work. And then we have a program that we support that particularly focuses on 16 to 24-year-olds in their journey to establish a career and move themselves forward. And we have youth services. I did want to point out that there is a new employer tool that the Lieutenant Governor has mentioned in his press conferences along with the governor, and that is Job Search Ohio. That is a tool that's been stood up outside of ohiomeansjobs.com. That tool can be used by, if you're an employer, you can easily go on, post your own job. It's a very simple application or single page form without the need to establish an account. It's much less rigorous than an employer account on ohiomeansjobs.com. It was set up really to capture essential employers that were looking for people to fill essential positions, but employers can continue to use that. Next slide. When we talk about what we've been hearing, I will say that even though the county departments of Job and Family Services do not operate the state's unemployment program, and you know, we try to say that often, we still get a lot of calls about that because Job and Family Services is Job and Family Services. Probably 90% of the calls that we continue to get into all of our phone lines are related to unemployment, related to people that are looking for help in navigating that system and just want to talk to somebody. So we've been able and pleased to help people as we can. The state has equipped us with information about how to answer questions. Our staff has been more trained in that unemployment system and just more attuned to how it works so that when people call, we can give them a little bit of direction. But by and large, people have been more appreciative of just someone to listen to their circumstance. And I will tell you that that seems to mean more than anything else to those individuals. So we, again, are happy to continue to do that as we can. Wanted to give you a little bit of a snapshot on unemployment and where we sit in Marion County. And you can see from the figures, the week ending March 14th, we had 21 people file an initial claim for unemployment, and we had about 212 that were continued from the weeks before. And that represented the norm. for that week and really the previous 2 years. And then March 21st, you started to see with 838 people applying for unemployment, the beginning of the peak or the surge, with March 28th, the week ending with 1,374. And for the next 3 weeks, a very strong uptick in the number of people that were initially applying and the number of people that were continuing to receive unemployment benefits. The week ending, I think the 25th, just came out this morning. So that week total for the next week after April 18th was 515 people. And so we can see that we saw a very strong surge and peak, and we're on the downward climb of those people applying. On the state side, you know, and I'm sure you have heard that we now have over 1 million claims that have been filed in the last 6 weeks. Approximately 200,000 of those remain, which is kind of amazing how well they've done at that unemployment office, despite the frustration and the long and many trials that you have had to go through to get through to that system. The average weekly benefit amount I've shown you, and the term of unemployment available to folks right now is 26 weeks, which was the state term that was in existence, and an additional 13 weeks that will be funded by the federal government. So that kind of gives you a snapshot of where we sit with people that are on unemployment. And as we focus attention on really our economic recovery and supporting our local economy, for us and in the OMJ Center, where we know that the mission critical was supporting families, and then the next mission critical will be rebuilding our economy and trying to kind of flatten the curve there as well. So we are knowing also that we're going to be needing to do business in a different way along with our business customers. So we are currently doing research and pricing for how do we do virtual job fairs, video interviewing in a meaningful way, building up our website so that it's more interactive and not static, and making better use of social media on our end on behalf of our employers. Now, what that's meant for us, and I think we can all identify, is that we are needing to upskill and enable our staff that haven't used that kind of technology in the past to become very quickly proficient in that technology, equipment, how to create materials that they've done in a different way, and even communication styles, when it's appropriate to use a remote method and when it's more appropriate to do a personal touch. Because as I said, both of those are necessary, and we try to do as much remotely as we can, but sometimes that's not the most effective way to do business. So we'll need to look at just when and where we use the most technology that we can, and when and where we need a personal touch with either an employer or prospective employees. I would, with Michalina, also talk about, for employers, we are seeing, and through social media in particular, that if employees don't believe their employer is supportive of the health restrictions that are in place, they very often voice that in social media. So for employers, as well as this agency, I think building safety into your brand and branding that strongly will be good for current employees as well as prospective employees when you start recruiting or when you start calling employees back. So with that, I will turn it back over to Matt. I know we have a lot of questions, and usually that's the best part of a webinar, so we want to get to that.
Thank you, Roxanne, and thank you all to our panelists here. We did have a lot of great questions come in during the presentation. So again, want to do a quick thank you. If you do need to leave, we will have this fully recorded, including the question portion. But I would just want to thank the panelists before we get into that. And then I'm going to, just review some of these questions that have come in, and some of them are going to be for certain panel members, some might be for all. So let's just say, let's see, if someone asks, if an employee tests positive, are we now testing everyone with symptoms? What if an employee is told they are likely to have COVID, but they weren't tested? Do we follow the same protocols as if they were tested?
Hi, Matt, this is Traci. So yeah, you can have a lab confirmed positive, or you can have a probable, and that's a probable is a person who is symptomatic, who was exposed to a lab confirmed case, but wasn't tested. And so they didn't meet the criteria for testing for whatever reason. And we treat those both the same. They're both considered a case of COVID. So a case of COVID, whether it's lab confirmed or probable, will be issued an order of isolation saying that they can't leave their house. And depending on whether they're critical infrastructure or not, it will be for 7 days up to 14, plus 3 of those days have to be without symptoms, without fever, anything like that. So that's what will happen. In addition to that, it's not just the positive case that gets isolated, it's whoever lives with them. So if you have an employee whose spouse tests positive or is a probable case, that employee will be put on quarantine as well. And they will receive an order of quarantine that they have to remain in isolation.
Thank you, Traci. All right, someone asked, when using a Dropbox for documentation for clients, how is it best to handle the paperwork? I'm not sure who that would be an answer for.
I can speak to, we have a Dropbox, and Tyler can correct me if we're doing it wrong. We have a Dropbox, and we've always had one. It's actually built into our building so that people are able to drop off documents, which we rely on a lot of paper verifications of things. That Dropbox on the other side drops into a secure area, and we empty and monitor that and scan all of that into our document imaging system. We're requiring gloves for all of the staff that handle that, that material, and also any of our staff that is processing mail. And we have instructed about how to put on gloves, but more importantly, how to take them off. And they're usually switching those gloves between the Dropbox, and then if you're also doing mail, they would put on a new pair of gloves to do that. So that's just how we've handled it, and I'm open to improvement if Traci or Tyler has that.
I think that's spot on. But also, if you have to handle any paperwork, just wash your hands before and
Right.
after.
Yeah. In addition to that, that's kind
Not
of the
even
most
with clients,
important
even
part.
with your coworkers. If you're handling papers, just wash your hands. That should be cover it pretty good.
Mm-hmm.
Awesome, thank you. We had a question about shared office space or leasing a leased space, and then kind of a shared restroom and common halls and waiting areas. I guess whose responsibility is that for the folks that are leasing it? And then there was concern about if your building management companies out of this area, are they going to be able to follow, are they following the same guidelines as what our local health department is?
Absolutely. Am I unmuted? I think I am.
No, you're good.
Okay. All counties are following these rules. This is mandatory for the whole state. So it being incumbent upon you, have that conversation with your building manager, see what the, maybe look at your contract, what that involves, and go over expectations. Maybe they expect you to, do this, but they're going to clean the bathrooms more. I'd say definitely have that conversation and go from there.
Cubicle users with no door and walls all the way to the ceiling. Do they need a mask? Only 2 people in the office normally.
I would say, Traci, you can just call me on that, Traci Rector. But you know, I've had a lot of good conversations. A lot of people are installing plexiglass between them and customers. Awesome, fantastic. But if you still have coworkers, if you're still working with somebody, you guys should be wearing masks.
Let's see what the PPP were to call back. With the PPP, if we were to call back an employee and they choose not to return, can those funds be utilized for an employee that we would need to hire to fill that position?
Yes, if you found somebody within that time frame to take over that position, that is an option you can do. It's not like they're tracking certain employees, it's more of number of employees. So that would be fine.
Then if the follow-up from Michalina, they received their 10K from the EIDL, but I have not been contacted by SBA requesting any loan balance of the EIDL. Do we just wait, or is there no response and know that we can't get any more loan, or do we just need to be patient?
There has been so many changes recently, and I can't say for certain whether they're still giving out loans or if they're just doing the advancements right now. Some people, if they have received their funds, typically they'll have a loan processor contact them within maybe a week after that. One way to see if they're kind of looking at you for a loan is if you noticed a credit pull on your credit, then that's most likely from the SBA. So that could mean that they're going to be contacting you soon. You could try to call the customer service line, but I know that is a huge pain and sometimes you don't get the answers you're looking for. So
Would their local loan or the bank that they worked with, would they be able to provide any answers on that?
With the EIDL loan, it goes straight through to the SBA.gov website. So unfortunately, it's not like the PPP where you can talk to your loan processor.
And then there was a follow-up on specifically the PPP. They feel it's pretty vague on as to what actual payroll periods and paydays that can be included. They were 2 weeks behind on payroll and a little concerned about the accrued and paid guidance.
Well, I know you have to start putting those plans into place. I think it's 5 days after you receive your funds, and then you have 8 weeks to spend those funds. So some businesses, unfortunately, because of not being able to bring everybody back and whatnot, you may be in a situation where you have to give some of those funds back unless you want it to turn into a loan. But I would recommend talking to your loan processor and working with them on that directly, because they're going to be determining if your loan's going to be forgivable or not.
Can they pay federal payroll taxes with the PPP funds? If so, what are the guidelines?
I'm sorry, what was that question again?
It was, can they pay federal payroll taxes with the PPP funds? And if so, what are the guidelines?
Can they pay federal funds?
Federal payroll taxes.
Federal payroll taxes. You know, I've seen that you could pay the state ones. I'm assuming you could pay the federal taxes too on that, but you know, I'm not completely certain on that. I didn't see that written in the PPP document I have.
Let's see if we can find that answer and add that to the follow-up. Let's see. This is for Roxane. What does ODJFS know or good guess on what is going to happen with childcare? Will pandemic licenses continue, or will we see a switch back to regular licenses? And what would you predict will be the childcare needs as we reopen?
We are still waiting for direction from the Ohio Department of Job and Family Services. I do have a guess. My guess is that the pandemic licenses will continue for a period of time, and then simultaneously we may have some regular licensed providers be able to open. I think it's fairly obvious that as businesses open and manufacturers are starting to open, that childcare becomes, a requirement or a necessity, unless and to avoid businesses having to get into paying employees under the expanded family medical leave to care for children. So I know that ODGFS is considering that and talking about that, and I expect that we'll have direction within the next week. But I think the pandemic licenses will continue for a period of time. And I see there's also kind of a question about part-time staff being eligible for unemployment. And the answer is yes, they are. Under the pandemic unemployment assistance program, which is totally federally funded, those people that normally wouldn't be eligible because they don't have enough weeks or attachment to the workforce, or they don't earn enough per week, which is $269, are eligible for the pandemic unemployment assistance. And just this week, the state has opened a pre-registration portal or tool on their regular website for those particular people to go in and register for. And they are kind of pre-registering, and then at the point that the full system is able to take applications, those people will receive an email advising them that they are now able to go on and complete their application. The state has hired a Deloitte actually to build a separate system outside of the regular unemployment computer system just for pandemic. And they expect that to be operational by the middle of the month. So far I know people have been successful in that pre-registration process, and the benefit amount would be a minimum of $189 just in base unemployment, and then those folks are also going to be eligible for the additional $600 per week for the period until July 25th.
Thank you, Roxanne. I think the next question is for Tyler. And I think there was another one in the general chat, I believe, that kind of follows this. And you did make mention, but are there any suggested webinars for cleaning departments to watch to assist with best practices during this time? And I think you mentioned that there was guidance that just recently came out about cleaning recommendations. But are there any other kind of webinars like that, or perhaps sample cleaning best practices that guides that to share?
Yeah, I'm not aware of any webinars per se. I've been on a few in regards to like food businesses and whatnot on disinfection practices. But I'll tell you, I'm going to send this to Matt, and within the link I sent you yesterday, Matt, there are a couple PDFs. I'm going to send those to you. One is, I don't know if you can see it, guidance for cleaning and disinfecting businesses. I'm going to send this out. It's a really good document. It goes through developing your cleaning plan that I had mentioned. It's super simple. And it talks about, a deep disinfection that the state keeps saying. What that means is cleaning first, soap and water, rinsing it, letting it dry, then using a chlorine solution. And in here, it talks about the EPA disinfectants you can use, talks about bleach and water that you can use. And in the back of this document, there's a bunch of hyperlinks where for your specific business, you just click on it and it has best practices, how to clean, whether, so it has different things, whether you're an office setting, a restaurant, a bar, a lot of different things. So I know Matt said he's going to send some stuff out after this, and that'll be one of the documents we send out.
Thank you. And I think perhaps the last question, Traci, what about the person who has symptoms but no contact with current person who tested, just a random person who hasn't come in contact with anyone known to have COVID, but is told by a physician that they are likely to have COVID?
That would be considered a probable case. So their doctor will do that assessment with them, figure out if there's other things that they need to rule out first, or if they feel like it's a COVID case. So if the doctor says that they are likely to have COVID, that's how we treat it, like they have COVID. The doctors are supposed to notify us when they get those cases, but they don't often do that. So we recommend, tell your staff to call us. If you have questions about all these kind of gray areas, our nurses are available kind of at all hours to answer those and walk you through what you should do and whether it's going to affect, a particular shift or a particular group of employees or not. So just call us anytime.
Awesome. Actually, I do have a couple more that came in from the other. One is they have heard mixed information on temperature checks on employees being a HIPAA violation. Can employers check temperatures at start of shift?
Yes, they can certainly do that. And what we've seen some of our employers who have been doing this for a while now is, they may have one particular person that's checking temperatures as everybody comes in. If somebody's temperature is over that 100.4, they're kind of pulling them out to a separate area where they can have private conversations and discuss it further. So they're not doing that part right there. They're just literally checking the temperatures.
Excellent. So let's see. I think that pretty much we've gone through all the questions I think that we've received. So thank you all again to our panelists. And unless was there anything from, if Sarah is in the line, anything you wanted to add to this? Sarah, our emergency management for Marion County. I don't know if she's.
I'm still here. I just thank you all for participating. And I mean, we're all finding out this guidance along with you and trying to help figure out moving forward what this is all going to look like. As you have questions, please, please, please contact any one of us and we'll help walk you through the process or help you find the answers. And you're going to come up with things that we haven't discussed or may not be a blip on somebody's radar. Some things after you first start to reopen and start getting feedback from your clients or your customers, other staff members, and we'll do our best to get you the answers as soon as we can. We're all in this together and we appreciate how much work has gone into everybody's changing status in their lives. And I want to just say a special thank you to Matt, who's been amazing working with the business community and helping us figure out the best ways to help support you. So thank you and just keep doing what you're doing.
Well, thank you very much, Sarah. And with that, I just wanted to thank you again so much to our panel. And Sarah, thank you for tuning in. We hope this has been helpful. We'll continue to provide email, social media, and newsletter updates as we get them, and continue to do all we can to help advocate on your behalf and provide you opportunities to market your organization, including a quick reminder that as we you get closer to reopening, or if you've got information to share right now with the community, don't forget our free email exclusive blast is a way to share your information. Just contact Doris at the Chamber. Thank you again. Our thoughts remain with each and every one of you, your families, and the families of the employees you care so much about. We believe in your strength and resilience and courage, and know absolutely that however messy this world will be, the fellowship of the Chamber will be at your side. Thank you so much again to our panel, and we will share all this information after this recording.